gotta get those triamcinolone orders. Ooh, it's really bright. Triamcinolone orders in soon. Yeah. And then what else was I doing today? I was getting an Accutane, a male Accutane start and a female Accutane start. It's gonna be a lot of work. We have to get a height and weight. And scare the patients off. Wow. Oh my gosh. Sorry, I did not see you there. How long have you been there for? You saw my. Did you listen? Were you listening? Hopefully you weren't listening too close. All right. All right. All right. Quiet. All right. So let me just pull up your health chart real quick because, yeah. Yeah, the front desk is supposed to let me know when they send someone back. Yeah, that was a mistake on their part. So let me just see here. All right, just gonna do a little looking. And can you verify your date of birth for me real quick? All right, last name still the same. That's good, it's lasting. All right, and is your first name still Bucket? All right, that might change soon. Let me know when that frontal lobe develops. But anyways, I think there is something else I wanted to confirm. Oh yeah, your pharmacy information, because that seems to change a lot for you. Are you still at the CVS? Perdón. The CVS on Wrightwood Lane. Okay, we've got that for you. And then primary care provider, we have Dean. Okay, and that's still the same? Oh, you've changed that again. Oh. Do you have a lot of issues with your primary care providers, or do you just like not go to them very well? Okay, yeah. I just recommend you try to stay a little longer next time because they do, like, you build a relationship with them and they're gonna have a better like understanding of your health. That's my only input. You know what, but if you wanna keep messing around with that, you can keep messing around with it, that's no problem. All right, and then as far as your intake from the front desk, I do see that you signed up for, you just wanted to have a acne follow-up from 4 months ago. Okay, got you. Let me just check the notes. Oh, and you were interested in some Botox too. Yeah, let me see. Frown for me real quick. Okay, big smile. Oh, let me just like mark that real quick actually. And then make a face. Go. Yep. All right. And then, okay, last thing I'm gonna have you do is I want you to raise your eyebrows, like kind of give me a little mew. All right, looks good. Thank you. And now, all right, I think I know what I would do. I would quote you for 26 units of Botox, 2 to the glabella, 4 to each lateral canthal line, and then 6 down to, okay, I'm seeing what I want to do. So if you want me to calculate that for you real quick, that would be $280 with the Botox Tuesday discount. Are you interested in that today? All right, I'll draw that up for you actually right now. Yep. All right, now just hold still, slight poke. Some people say this feels good. All right, there you go. Oh, this is gonna be really good for you. All right. Just gonna apply some pressure, slight bleeding of the glabella. Mary. Hey Mary, remember, you're supposed to be assisting me, so yeah, get over here. Don't be shy. See, I want to hear you. If you're not assisting, I want to hear you type. Yeah, like I should be hearing you typing constantly. And then if you're not typing, I should hear you. Yeah. All right. Oh, wow. Okay. Right. Ice pack. Come on, girl. All right. I'm just gonna have to make a note of Mary's poor application of the ice pack because she's running on thin ice. That was a pretty good joke, wasn't that? Alright. So now that we applied the Botox, I'm gonna wipe the blood off. You also wanted to talk about rosacea and your acne. Okay, the rosacea flare, I did notice it was flaring a little bit. It was further flaring because of the, like right now, it's extra irritated because I just stabbed you with the needle, of course. But I will say that there's a really good anti-redness cream. It basically acts as a vasodilator and it constricts your blood cells in your face, which is essentially what's causing your rosacea. And yeah, so it's got, have you ever heard of clanamide, clobetasol? Sorry, forgot the word there for a second. Take away my license. Yeah, clobetasol or clindamycin, or triamcinolone. Have you heard of triamcinolone? Okay, well, those are the active ingredients in this rosacea cream, and this is like a brightening. So I'm gonna prescribe you that, and it should be only $20 if insurance covers it. Yeah, and they're gonna cover it because I'm just gonna say that it's medically necessary. And then, alright, as far as your acne vulgaris, I'm just gonna get a quick examination of. Right, Mary, note that there are 4 to 5 semi-inflamed papules on right anterior canthal line, 3 to 4 semi-closed comedones on the left medial cheek, and okay, I'm getting 1 cyst on the right medial cheek. Get all that? Bet she did. Alright, so that is enough to qualify you for, if you're interested in a permanent treatment, like we could go Accutane. I know I've discussed that with you before. It is very intense, and I would recommend you wait till fall, which we're getting close, so you could come back in September maybe, and then you'll be a little closer. Yeah, but I think that for you, tretinoin would do wonders, and that would honestly be enough. Yes. And then on top of that, have you ever heard of spironolactone? Okay. I'm thinking I'm also going to send a prescription through. It's an oral medication. It's technically a blood pressure medication, but it's used offhand. Yes, it's a very bad blood pressure medication. I don't actually know if it's used for that anymore ever. However, especially you can only use it in females. Especially for females, or assigned female at birth, excuse me. It helps control the amount of testosterone, which is, from my diagnosis, you are producing a lot of testosterone, basically. Yes. So it helps block testosterone, and it'll really just get rid of, yours looks very hormonal to me. So with tretinoin, Spiro, I'm really looking forward to see what your skin looks like. Yes. All right. Okay, I think that's a great plan. I'll check back. Mary will get you scheduled for, let's do a 3-month follow-up. I think that sounds good. And Mary, I'll also grab your blood pressure. Don't forget that. And yeah, I think, any other questions for me? No? All right. Well, it was very nice to meet you. Yes. I've got another person to see. So yeah, have a nice rest of your day. And yeah, Mary, I'll get you all checked out. You'll pay at the front, and yeah, you look great. All right, bye.